Hello everybody, this is Dr. Kevin Connors, and in this presentation we're talking about cancer cures, and here we're going to be talking about Rife technology. 5 ways Rife technology changes the way that we treat cancer today. And it should be changing the way everybody treats cancer. That's my opinion, of course. But we've seen miracles after miracles using the Rife, and we just want to shout it from the mountaintops. People that are not using the Rife are missing, a big piece of what could help them get better. It is not a miracle cure. Doesn't cure everybody, and you have to have your body ability to heal has to be there. The biggest mistake that people make with the Rife when they use the right frequencies and they're using the right equipment is that they wait too long. So, uh, but that being said, we've seen stage 4 cancer patients that were literally given 2 weeks to live by Mayo Clinic. We practice in Minnesota, so we have a lot of Mayo patients, uh, and sent home to get their affairs in order, live, and several years more, and die from other causes. So it has been just a miracle cure, you could say, even though we're using the word cancer cures. I don't believe anything cures cancer. It's been a miracle uh, cure in the sense that it's given people their life back and allowed them to manage their cancer for a lot longer than was ever expected. And it's just been a blessing. So we're going to go down these 5, 4, 3, 2, 1. How understand there's at least 2 dozen different technical understandings and philosophies on why Rife light frequency works. We're just going to hit 5 here that I think are easier to understand. Number 5, I should say, Rife light frequencies vibrate the cells that they're targeting. If you hit anything with its own frequency, you cause it to vibrate. And that is important when you're dealing with cancer cells. One of the things that cancer cells do to evade uh, getting killed by your immune system is that they, because they're rapidly replicating, they're creating a lot of waste. And that waste in itself is acidic. So you may have heard that cancer doesn't grow in an alkaline environment, and it's because you're acidic that causes cancer to grow. Um, well, if you've read any of my information or seen any of my other videos, I don't believe that that's exactly true. Though acidic tissue can cause problems, it is really the rapid replication of the cells causing so much waste that is producing acidity. And cancer in itself is producing an acidic environment. Now, that acidic environment collects around this rapidly growing cell mass, and that in itself physically keeps away an immune attack. It prevents an immune attack on the rapidly growing cell mass, the cancer itself. So hitting it with its own frequency physically causes that to break up, and physically helps the lymph system carry that away, and physically will allow the immune system to help attack it. So in itself, using Rife technology can help your immune system kill the cancer. Now, this presupposes that you're doing some things that will stimulate an immune response and build an immune response. If you're in the middle of doing chemo and radiation where your immune response is so diminished already, you need some support with that as well. So this 5th piece is not going to have as much effect if your immune system is diminished, or if you're in the stages of death that your immune system is shut down. So it's very important to do things to increase the health of the immune system as well. Number 4, Rife light frequencies help bring resonance back to the cells that are targeted. From a quantum physics perspective, everything has its own resonance, has its own resonant frequency. And part of the problem with cancer is that it's resonated at a different frequency than it should have been. So if you hit any tissue with its own resonance, this is the argument that that people will make. Well, if Rife light kills cancer cells, wouldn't it kill your liver cells too? Wouldn't it kill your healthy cells? How can it only kill the bad cells, quote unquote, and not kill healthy cells? Well, when you're hitting it with its own frequency, you're bringing resonance back to that tissue. You're not necessarily trying to kill the cancer. You're trying to bring the resonance back to those cells so the cancer cells don't act like cancer cells anymore. And we're going to talk a little bit more about that in these steps. But remember what cancer is. Cancer isn't some crazy different cell that's not normally in the body that's now taking over your body. Cancer is your own tissue cell. So if I have liver cancer, it is a liver cell that instead of going through its natural apoptosis cycle, meaning going through a life cycle, doing its job, and then going through a death cycle called apoptosis, where the cell components are recycled back by the body and the cell dies. The cell doesn't go through apoptosis for a specific reason. We talk about that in multiple different slide presentations on our website, so check that out. And then it goes into a rapid replication cycle, and there's a reason for that too. Finding the cause of that is a huge piece of what we want to look at. So if, by definition, a cancer cell is in a state of rapid replication, if we can bring normal resonance back to that cell, you can help, from a quantum physics standpoint, stop it from being a cancer cell. So not just the cancer itself, but dealing with the rest of the liver. So if I have liver cancer, if I can get my liver back to normal harmonic resonance, I'm going to be able to help detox and do everything that the liver is supposed to do. If I could get my immune system back to normal resonance, I'm going to help stimulate an immune response. If I could get my thyroid, any tissue cell we're talking about, if you hit it with its own frequency, you're going to bring normal resonance back to that tissue. You're going to help with bringing the normal quantum physics frequency back to that tissue. And that's a huge piece of what Rife does. Number 3, Rife light frequencies alkalize the tissue that it's targeted. So if we're doing a liver frequencies on a person, and you're using and that's what's coming, those light frequencies are coming through the Rife bulb, then you are going to alkalize the liver because you're targeting those liver cells, and light being a waveform that is also a photon on a waveform acts as an electron donator. So it donates an electron to the tissue, and when you donate an electron to the tissue, you are raising the pH of the tissue. So some people argue that this is the biggest way that Rife technology actually helps people with cancer and other diseases, is you're alkalizing the tissue. And as we stated before, cancer is acidic in its own realm because of its rapid replication and producing so much waste. So alkalizing the tissue is very important. Number 2, Rife light frequencies can stop cancer cells from being cancer cells. Kind of what we talked about in the 4th one. If we can bring resonance back to those cells, you can induce an apoptotic cycle. You can stop, in this case, stop a rapid replication cycle. So if we can stop it from rapidly replicating, then it may still be there, but it's not rapidly replicating anymore. And we see this very common with patients, that the mass is still there, but it stopped growing. So is that good? Is that bad? And that's humongous. So do we care that the cancer goes away? No, we just want those cells to stop being cancer cells. And when I say stop being cancer cells, I mean stop rapidly replicating. We don't care if they all disappear. We just care that they stop replicating. They're no longer acting as cancer cells if they're not in rapid replication anymore. We'll just let them stay there and let the body wall it off. That's just fine by us. And number 1, Rife light frequencies can kill cancer cells. So not only can they stop rapid replication, therefore they're not cancer cells, quote unquote, anymore, they can cause apoptosis to take place. And this is what Rife actually found with his microscope. He saw that there was actually a lysis, so there was actually a necrosis of the cancer tissue using light frequency. And we do see this at different times where a person comes in and their cancer, they go back and do another MRI or CT and their cancer is greatly reduced in size or gone. And that seems to be kind of what patients in their mind want, because that tells you that the cancer is gone. However, we got to be careful, because just because you can't see it on MRI or CT scan doesn't mean it's completely gone. In my belief, again, it's just never cured and it's never completely gone, and you need to just learn to manage it the rest of your life, and using the Rife is a key component of that. However, uh, it does not always happen that way. So, and again, that's not always even what we're trying to do. We don't want it to disappear. We just want it to stop being a cancer cell and stop replicating. So hopefully this helps you understand. We use Rife in our office. All our cancer patients go home with a Rife machine, and it's an essential part of our treatment, using the right frequencies, using the right machine, using the right amount of time on the frequencies is essential. That's exactly what we do in programming it. But it's not all that we do. You have to, like I said earlier, stimulate an immune response. You can use nutraceuticals to help kill the cancer. You got to look at different metabolic pathways that may be blocking different things. It's a complex thing. I don't want to try to make it sound simple, but if you could get to the source and the cause, and be able to halt it from being cancer, you can see miracles. And the Rife is certainly a piece of this. Make sure you check out the other videos on our website. It's up there in the left-hand corner, or call our office if you have any questions. Thanks, and God bless.